Hi, my name is Susan Hoover, and this is blog 3 about management experiences, transdisciplinary teamwork, um, and touch base a little bit just about vertical and horizontal structures. A little bit about me and about where I get most of my ideas from and where I pull my experiences from is I've worked in maternity for like 11 years now and recently changed jobs from an LDRP setting, 24-bed unit, to just a mother-baby 36-bed unit, where we average about 6,000 deliveries a year. So it's a little bit bigger volume than what I have currently been used to, and I've noticed a few differences with the way both of the units are run. And I've taken from the readings and my experience key areas I would include if I were a manager. My primary goal would be to put my staff and to provide safe and effective nurse to patient ratios. I know my current manager evaluates our past delivery numbers to projected numbers to create a start on how many nurses we need to staff our unit. She has also used research or even evidence-based practice guidelines to develop an acuity matrix that addresses patient security to nursing tasks. I feel that this is highly important when staffing a unit, especially with dynamics of our changing patient population. New policies and increased tasks play a huge role in how we can staff our units. And we also need to account for the decrease in length of stay for patients and how these impact the ways we educate our patients for discharge, and also how many discharges a nurse might have in a daily shift, and also how many admissions that she would actually be picking up. This also needs to play an important role in what we do. I know that the budget also needs to be a part of this, but our primary focus does not need to be on the budget and shift away from our patient safety. Patient safety still needs to be number one. As a manager, I would need to effectively communicate with my frontline staff. I would need to incorporate the concepts of shared governance that is discussed in Chapter 7 of our textbook. Currently being a part of a hospital that incorporates shared governance, I feel this allows the staff to collaborate and involve themselves in creating a healthy work environment. As a manager, my biggest task would be to how could I motivate my staff and promote an environment where individuals have input on their environment that they work. My first class um, for my RN to BSM venture, I wrote a paper on job satisfaction and acuity-based staffing. Job satisfaction, nurse retention continue to be issues in hospitals today. Part of that contributes to the environments that we have to work in. Nurse job satisfaction is affected by the workloads of the nurse, so this, if I went the management route, definitely would be one of my primary focuses is on how I could use evidence um, to use and collaborate with what our nurse to patient staff ratios need to be. Key components are mentioned in several of the articles that I read about job satisfaction that evaluate ways to increase nurse retention and create a healthy work environment. Having appropriate nurses to patient ratios helps nurses to feel that they can provide safe and effective care for their patients. One way to do this is to examine the task patient care duties of the nurse. After completing the leadership questionnaire, I scored very high in the conceptual skills of leadership. I see myself as a person who is a good problem solver who recognizes the importance of addressing them accordingly. With changes in healthcare, if I were in management, I would be able to see how being flexible and acknowledging the big picture is important. Monthly council meetings and quarterly staff meetings, along with daily morning huddles, are ways I could incorporate into how I can incorporate communication with my staff and allow staff to collaborate with solutions to help our unit run effectively and smoothly. I feel the more you are visible and more that you communicate with your staff and keep them informed, the better. This helps with how they view you as a manager and how they feel about where they're working. I'm pulling from my own experiences as a staff nurse and what I would like to see from a manager. I feel in order for me to be an effective leader, manager, I need to remember what it is like to practice as a frontline staff nurse, to be effective at my role, and to know the needs of my staff. I would need to look at the big picture and recognize the entire interdisciplinary team playing a part with creating an inviting work environment. I will need to collaborate not only with the executive officers like the CEO, the CNO, or the CNO, but I would also need to find quality time to collaborate with our sister units and their managers, physicians, dietary, maintenance, social work, to name a few. I would need to recognize the importance of how each discipline works independently and works together. This would help to see how we could effectively manage a unit, especially with the emphasis now on HCAPS and creative management. The article I found on transdisciplinary teamwork discussed the collaboration of simulation experiences with nursing students, actually, to work towards reducing medication errors and improving patient outcomes. This would be a creative way of allowing staff to practice as a team, the key components to include during a medical emergency. The article discussed the importance of providing checklists identifying critical tasks. They would also be able to practice these mock codes, which would improve communication and teamwork. It would help us staff identify roles during simulation emergencies. I think that it's very important to have mock codes in order to practice so we can get efficient at communicating with one another and working as a team. With the organization I currently work at, we are a combination, I believe, of a vertical and horizontal structures. We operate like a vertical structure with our CEO or president at the top of our organization, along with our chief officers. We operate utilizing our chain of command where each person has a job description that they follow. This is incorporated throughout the hospital in each unit. We also operate as a horizontal structure within each unit too. We do still follow a job description with specific job duties, but at the same time, we share input into how the unit is run and work as a team. We do have a few A&Ms. We also have a charge nurse that runs our unit each shift that each team member can also report to during their shifts. This is just a brief I guess example of what I would do if I was in a manager position. I haven't really thought about going into a manager position, but it definitely is, I guess, a skill just to recognize some of the strengths that I have and some of the things that maybe I can work towards and didn't know that maybe I could possibly do in the future. Hope this helps, and I can't wait to see everyone else's. Thank you.